Thank you for joining us this evening as we present Navigating HIPAA and Telemedicine during COVID-19. My name is Cindy Pankella, and I am the Director of Practice Management and Education at the American Osteopathic Association. And our speakers this evening are going to be Hamil and Brian Tuttle. Ms. Little has over 23 years of experience as an attorney. She is a former federal prosecutor for the United States Department of Justice. She is also the former general counsel of Augusta University's AU Health System, including its Hospital and Physicians Practice Group, AU's Medical Associates. She is a partner in the private healthcare law firm of Hamil and leads its legal team in numerous matters on behalf of physicians, significant medical practices, and other healthcare providers, business owners, high-level professionals, and successful entrepreneurs. Most of her engagements involve legal issues in healthcare that are regulatory, transactional employment, or litigation-based. We're very happy to have her with us. And then Mr. Tuttle is a certified professional in health IT, certified HIPAA professional, a certified HIPAA administrator, a certified business resilience auditor, certified information system security professional with over 20 years experience in health IT and compliance consulting. With vast experience in health IT systems, as well as over 20 years experience in standard health IT with multiple certifications and hands-on knowledge. Brian serves as compliance consultant and has conducted on-site and remote risk assessments for over 1,000 medical practices, hospitals, health departments, insurance plans, and business associates throughout the United States. Brian is well known and highly regarded in medical circles throughout the United States for his quality work in down-home Southern charm. While they are giving the presentation, any questions that come up, please, attendees, please type them into the question and answer box, and we will answer them following the presentation. And I will now turn it over to them. Go right ahead.
All right. So this is Brian, obviously. I will go ahead and get started here, and just to sort of speak to what we're going to be obviously talking about is what's going on in the world of HIPAA with this virus going around, and what are some of the ways we can safely conduct medicine through remote means, through telemedicine. And there's certainly technologies out there that allow us to do this, but the federal government has lifted some of the regulations as it relates to what we can and can't do. So without further ado, I'll get started here. We have a pretty big crowd, so we'll try to wrap this up at the I guess it would be 7:50 Eastern mark, and then leave that open for Q&A that you guys have, and then we'll get to those at the end of this thing. So let's get started here. We all know what this coronavirus outbreak is. Everyone knows about this. There's no need to get into great detail about this, but let's just step back for just a second, jump up to the Centers for Disease Control up in Atlanta. And this really all began in roughly December of 2019 over in China. It's known as COVID-19, hence the 2019. It's very similar to the SARS outbreak that was it occurred out there in the past, and it was where it began, so they're pretty certain, was in Wuhan, China. So real quick, the symptoms: flu-like, fever, cough, respiration difficulties, fatigue, myalgia. Those are the typical symptoms that one would have if they're afflicted with this thing. The incubation period, 1 to 14 days, and as they say, if it's after 7 days, things can tend to either go worse or better, and that tends to be the tipping point for a lot of folks. The mode of transmission, human-to-human transmission via respiratory droplets. Now, this is directly from CDC. Prevention tips: avoiding close contact with sick individuals, frequently washing hands with soap and water, not touching the eyes, nose, or mouth with unwashed hands, and practicing good respiratory hygiene. So we know what it is, so let's shift gears now and talk about what's going on at Health and Human Services. And just a quick understanding of HIPAA, Health and Human Services is the governing body of this regulation, but it's the Office for Civil Rights that enforces these HIPAA laws, because it's a federal civil right every American enjoys, that your health information be secured as well as accessible to you. So hence we have these HIPAA privacy and security regulations. Now, HHS is the governing body of what the Health Insurance Portability and Accountability Act. It's interesting, HIPAA is a very, very robust regulation. It's like an octopus. It gets into all different areas of other laws and other regulations as well. But all we really deal with as practice managers, as business associates, as providers, it's the privacy and security aspects of this regulation. Now, and another thing about this regulation, it's always enjoyed a lot of bipartisan support from both the right and the left in terms of doing more to better protect American health information, because historically, healthcare has been a leaking bucket of identity theft, of fraud, of all sorts of data breach. And we've had no real regulation but HIPAA, which up until really around 2013 was not enforced to a great degree. That's just not the case anymore. And these fines are nasty, and they're real. And the common denominator when you hear of these horrible nightmares, it's willful neglect. None of this stuff's rocket science, but we've got to be proactive, make sure we are complying with this regulation. And another thing about HIPAA, there's no perfection here. It's a principles-based regulation based upon reasonable and appropriate due diligence, which we'll get into more later when we talk about some of the things that have been lifted a little bit, but that does not mean we can in any way be negligent here. So that's a little bit of what the background here is. And just by definition, HIPAA, basically, the Health Insurance Portability and Accountability Act of 1996, also known as the Kennedy-Kassebaum Act, named after its founder, Senator Ted Kennedy, a Democrat from Massachusetts, and Senator Nancy Kassebaum, a Republican from Kansas. So this is one of those areas, again, that's always enjoyed a lot of bipartisan support. Now, it contains the privacy rule, the security rule, and the breach notification requirements. This applies to individually identifiable health information created, received, maintained, or transmitted by healthcare providers who engage in certain electronic transactions, health plans, healthcare clearinghouses, and all of those business associates. And by the way, there's about 10 times as many of those business associates as there are covered entities. Now, in March of 2020, this month, I want to read from the COVID-19 HIPAA bulletin, the limited waiver of HIPAA sanctions and penalties during a nationwide public health emergency. Now, what we're talking about here is hospitals. This is for hospitals. So we'll spend a couple minutes on this and then shift gears into the telemedicine aspects and what we can and can't do. So relating to hospitals, and by the way, if you want to see this, the link here for the bulletin, here's the link to it. And a lot of this I'm reading pretty straight from, almost verbatim, because this is straight from the source. And since this is extremely important, I don't want to just bullet point out the basics of this. So real quick, the novel coronavirus disease outbreak imposes additional challenges, obviously, on healthcare providers. And there's a lot of questions that arise about the ability of entities covered by these HIPAA regulations to share information, including with friends and family, public health officials, and emergency personnel. So the HIPAA privacy rule, in of itself, as it stands, does allow patient information to be shared to assist in nationwide public health emergencies and to assist patients in receiving the care that they get. In general, health of the patient typically trumps HIPAA when it's in a provider's best interest in a typical HIPAA scenario. So while the privacy rule is not, and this is important, is not suspended during a public health or other emergency, the Secretary of Health and Human Services may waive certain provisions of the privacy rule under what's known as the Project BioShield Act of 2004 and of Section 1135 of the Social Security Act. So, in response to President Trump's declaration of a nationwide emergency concerning COVID-19 and the security of the U.S. Department of Health and Human Services, a guy named Alex Azar, earlier declaration of public health emergency on January 31st, 2020, the HHS Secretary has exercised the authority to waive sanctions and penalties against a covered hospital that does not comply with certain provisions of the privacy rule. Now, it's only certain provisions. Here are the provisions that in a hospital we're not necessarily going to have to comply with at this point. And this is short term. This is not long term. So the requirement to obtain a patient's agreement to speak with family members or friends involved with that patient's care. The requirement to honor a request to opt out of the facility directory. The requirement to distribute the NOP, which is also, of course, the Notice of Privacy Practices. The patient's right to request privacy restrictions. The patient's right to request confidential communications as well. These have been reined in due to this situation that we're dealing with. Now, when the HHS Secretary issues these types of waivers, it only applies to in the emergency area identified in the Public Health Emergency Declaration, to hospitals that have instituted a disaster protocol, and for up to 72 hours from the time the hospital implements its disaster protocol. So when the presidential or secretarial declaration terminates, a hospital must then comply with all requirements of the privacy rule for any patient still under its care, even if 72 hours have not elapsed since the implementation of its disaster protocol. So let's talk a bit more about, in general, emergency situations, about disclosures in emergencies. So even without a waiver, and a lot of folks don't realize there was a lot of flexibility even without this waiver. So even without a waiver, the privacy rule allows patient information to be shared for the following purposes and under the following conditions, such as for treatment. So you may disclose without a patient's authorization in order to treat the patient or to treat a different patient. This includes the coordination or management of healthcare and related services by one or more healthcare providers and others, consultation between providers, and the referral for patients for treatment. That's called also continuity of care. So in typical circumstances, the primary care doctor can speak to an orthopedist about the broken bone x-ray without consulting the patient for approval, and even in general circumstances. Now, more about emergency situations for public health activities. This recognizes the legitimate need for public health authorities and others responsible for ensuring public health and safety to have access to PHI that is necessary to carry out their public health mission. Now, that could be a public health authority like the CDC or a state or local health department that is authorized by law to collect or receive such information for the purpose of preventing or controlling disease, injury, or disability, and at the direction of a public health authority, perhaps to a foreign government agency that is acting in collaboration with the public health authority, and to persons at risk of contracting or spreading a disease or condition if other law, such as state law, authorizes the covered entity to notify such persons as necessary to prevent or control the spread of the disease or otherwise to carry out public health interventions or investigations. And also disclosures to family, friends, and others involved in an individual's care and for notification. So family members, relatives, friends, and other persons identified by the patient as involved in the patient's care. I think that's clearly understood. Now, you can share information about a patient as necessary to identify, locate, and notify family members, guardians, or anyone else responsible for the patient's care or of the patient's location, general condition, or death. Now, you should get verbal permission from individuals or otherwise be able to reasonably infer that the patient does not object. When possible, of course, if the individual is incapacitated or not available, we may share information for these purposes, once again, if it's in the provider's best judgment in doing so. Anytime as a provider, anytime you make a disclosure like this, when you're using professional judgment, make sure and document that in the patient's health record, why it happened, when it happened, and to whom the disclosure was made to. That's very important. We may also share protected health information with disaster relief organizations like the Red Cross and groups that are authorized by law or their charters to assist in these disaster relief efforts. And also disclosures to prevent or lessen a serious and imminent threat. Now, we can, covered entities can share protected health information with anyone as necessary to prevent or lessen a serious and imminent threat to the health and safety of a person or the public consistent with applicable laws, such as state statutes, regulations, or case law, and the provider's standards of ethical conduct. Thus, providers could disclose a patient's health information to anyone who is in a position to prevent or lessen the serious and imminent threat, which might be family members, friends, caregivers, law enforcement, without permission. HIPAA expressly defers to the professional judgment of health professionals in making these determinations about the nature and severity of the threat. So again, when you do make these types of disclosures, make sure and document in the health record why it was done, what was the nature of the emergency, who it was disclosed to, and date and time and all of that. Now, what about the media? Disclosures to the media or others not involved in the care of the patient. So affirmative reporting to the media or the public at large about an identifiable patient, or the disclosure to the public or media of specific information about treatment of an identifiable patient, such as specific tests, test results, or details of the patient's illness, may not be done without patient authorization. Now, where a patient has not objected to or restricted the release of protected health information, a covered hospital or other healthcare facility may, upon a request to disclose information about a particular patient asked for by name, release limited facility directory information to acknowledge an individual is in fact a patient at the facility, and may provide basic information about condition, like they're stable, they're critical, that type of thing. You may also disclose information when the patient is incapacitated, once again, if it's in the best interest of the patient. And always, anytime disclosures are made, we go by what's known as the minimum necessary standard. This is all through HIPAA, and it's kind of common sense. It's just only disclose what's minimally necessary to disclose about someone. So we always want to make reasonable efforts to limit the information disclosed to that which is the, quote, minimum necessary to accomplish the purpose. Now, these minimum necessary requirements do not apply, though, from doctor to doctor in continuity of care for treatment purposes. If one doctor says, I want the whole record, that's fine. We're talking about general disclosures to others outside of that scope. Now, covered entities may rely on representations from a public health authority or other public official that the requested information is the minimum necessary for the purpose when the reliance is reasonable under the circumstances. So for today, for example, a covered entity may rely on representations from the CDC that the protected health information requested by the CDC about all patients exposed to or suspected or confirmed to have COVID-19 is the minimum necessary for the public health purposes. So, in also relating safeguarding patient information. So even in an emergency situation, covered entities must continue to implement those reasonable and appropriate safeguards, and the words reasonable and appropriate are used all through the HIPAA legislation. Reasonable and appropriate safeguards to protect patient information against intentional or unintentional impermissible uses and disclosures. Further I just lost my spot. Okay, sorry about that. Further covered entities, let me back this up for a second here. There we go, sorry. Further covered entities and their business associates must apply the administrative safeguards, physical safeguards, and technical safeguards of the security rule, which is related to electronic protected health information. So very important in any organization, any covered entity, that you have your HIPAA security risk assessments completed, and we've been proactive with that, because if a breach occurs, the big breach happens. By law, we have to notify. More than likely, you're going to get audited. The very first thing the federal government, typically the very first thing the OCR would ask for in the event of an audit is submit to us your most recent enterprise-wide HIPAA security risk assessment. When was it done? Was it done in the last year? We don't have to be perfect, because this is a principles-based law, but we have to show proof of due diligence, or things can get really, really ugly here. So a few frequently asked questions. Now, some of these are questions that I came up with. Some of these are directly from the government, that some of these may answer the questions that you have. Now, moving away from the hospital scenario and just getting back in general health care, what disclosures are we permitted to make to public authorities relating to COVID-19 cases? So we can disclose PHI about individuals who are suspected of having contracted COVID-19 to public health authorities that are authorized by law to receive it. This includes agencies or authorities of the United States government, a state, territory, a political subdivision of a state or territory, Indian reservation, that is responsible for public health matters as part of its official mandate, as well as a person or entity acting under a grant of authority from or under contract with a public health agency. Now, some states, state law can only be more strict than federal in these types of situations, but some states, they have their own mandatory legal requirements to report infectious disease cases like COVID-19 to state or local public health authorities, but again, always based upon the minimum necessary standard when we make these disclosures. What about the media? We cannot disclose to the media unless authorization is provided by the patient. You could give something very basic, like how many total numbers of patients are being treated at the facility, something like that, but you cannot disclose to the media without permission of the patient. If these types of things can, if some kind of disclosure was made to the media without authorization, that could definitely lead to a lawsuit, perhaps, from that patient saying, I never allowed this. What about risks relating to internal staff? Now, this has more to do with every individual who accesses an electronic health record system has to, for example, if I go into your health record with no business being in your health record, I have violated your federal civil rights. And technically that carries up to a year in federal prison. So I think staff are aware of this, but with this heightened situation, just keep an eye on those audit logs. And by law, all these systems track everything that we do and make sure staff understand that. I don't think that's a big problem, but it's important to understand everyone has a personal responsibility here. And it's important that you educate your staff and they understand this clearly. They sign off on confidentiality agreement upon hire. They're trained upon hire and annually to understand this stuff, because hypothetically, if we didn't, and then some staff member did something really stupid and made some stupid disclosure, yeah, they could get in some serious hot water, but the practice could be held accountable as well under certain laws of negligence and things of that nature, which Lee will speak to here shortly from that perspective. But it's just important for us to always stress that. And again, I don't think this is a big deal, but important to know. So the director of the Office for Civil Rights is Roger Severino, and again, OCR is the enforcement body of this. So I want to get into telemedicine now about some things that we can do that in the past we could not do that would not be compliant. So real quick, a quote from Mr. Severino, and he has stated that we are empowering medical providers to serve patients wherever they are during this national public health emergency. We are especially concerned about reaching those most at risk, including older persons and persons with disabilities. So with that said, there's been some, I guess, lifting of some of the standards relating to telemedicine. Telemedicine's been around a while. I think you guys know what this is. Now I want to read what they're talking about here. So this came out March 17th, St. Patrick's Day, 2020. The Office for Civil Rights suspended enforcement of penalties relating to telemedicine. Now, it's important, though, to remember that we still have to be careful here. So during COVID-19 national emergency, which also constitutes a nationwide public health emergency, covered healthcare providers subject to the HIPAA rules may seek to communicate with patients and provide telehealth services through remote communications technologies. Now, that's always been there. Some of these technologies, though, and the manner in which they are used by HIPAA-covered healthcare providers may not fully comply with the requirements of the HIPAA rules. So that's what we're talking about, not using non-HIPAA compliant types of technologies to communicate. So OCR will exercise its enforcement discretion and will not impose penalties for non-compliance with regulatory requirements under the HIPAA rules against covered healthcare providers in connection with, quote, good faith provisions of telehealth during the COVID-19 nationwide public health emergency. This notification is effective immediately. And Lee, did you want to speak to good faith, what that exactly means?
Absolutely. So OCR explains what they consider to be good faith. They won't impose penalties if you're acting in good faith during the COVID emergency. And so that means a healthcare provider can use audio or video communication technology to provide telehealth to patients during this public health emergency. And they are able to use non-public facing remote communication products. And so OCR actually provides examples of different communication vehicles that are considered non-public, and then other ones that are considered to be public facing. And so healthcare providers in good faith just need to make sure that they're using the ones that OCR has said are to be used in good faith. Moving on to talk about the definition of good faith, a healthcare provider in the exercise of their professional judgment can request to examine a patient exhibiting COVID-19 symptoms, for example, using a video chat application or that connects with the provider or patient's phone or desktop computer so that they can access a greater number of patients while also limiting infection to persons who would be exposed by patients that may be infected at an in-person consultation, and that would include healthcare providers too. Certainly it limits their own risk to be able to see patients by telemedicine rather than in person at this time. But the services that are provided by telehealth don't have to be limited to those related to COVID-19. They can be to treat any medical condition during this crisis, such as examples here, a sprained ankle, dental consultation, or psychological evaluation. So a lot of that kind of healthcare is happening right now in good faith. Also, OCR has published an FAQ sheet about these waivers concerning telemedicine, and they've given examples of things that would be bad faith. And so, that is a link that we're able to provide so that you can take a look at different FAQs. But some of the things that may be considered bad faith would be if a healthcare provider used patient information to commit a criminal act like fraud, or if they committed identity theft or invasion of privacy that was intentional, or if they used PHI that was obtained in telemedicine in ways that are prohibited by HIPAA, such as selling the data or using it for marketing without authorization. Also, if a healthcare provider violated state licensing or ethical laws with patient information that was provided to them through telemedicine, that would be a bad faith example. And then the FAQs that OCR provides also share some public-facing types of communication products that they say don't use these. And examples there are TikTok, Facebook Live, Twitch, or a chat room like Slack, SLACK. And those are ones where the communication vehicle is just typically open to the public and has unlimited ability for the public to access it.
Right. And so basically, things like FaceTime, Facebook Messenger, Google Hangouts, Skype, in typical times are not considered HIPAA compliant. However, because of this situation, they're allowing us to do these types of technology. I mean, they're relatively secured, but certainly not, quote, HIPAA compliant, because none of these groups will sign a business associate agreement for that technology. And plus, the information, while it's encrypted back and forth, it's still going through these servers at those groups that are not necessarily secured to that level of compliance, the audit controls and things of that nature. But under this particular circumstance, it's acceptable. One thing I would point out, though, if you're going to use one of these non-compliant technologies, even though they've lifted the standard, it's still a good idea to get the patients to acknowledge, I, Brian, want to communicate with the practice using, I don't know, Facebook Messenger. I acknowledge this is not HIPAA compliant. I understand that. I understand under the circumstances, I will not hold the practice, accountable, blah, blah, blah. Just so they understand that, And again, as Lee was saying, the non-public stuff would be in those, like Facebook Messenger. You have to log in. That's within the Facebook portal. It's relatively secured, but Facebook Live isn't. And these things, Twitch, TikTok, and they're not, because that's public domain, essentially. People can see that. So those should never be used. Now, covered providers that seek additional privacy protection, there's a lot of really good telehealth technologies out there that are already there. So if we're using these products, we should provide such services through technology vendors that are compliant and will enter into a business associate agreement. Now, a few that OCR lists, and OCR listed these, but that doesn't necessarily mean that they're, pushing these products. But there's plenty of good HIPAA compliant technologies out there. So what you don't want to do is get used to using FaceTime or Facebook Messenger, things of that nature, and then forget when this thing's lifted, or it's put back in place rather, and don't continue to use those. So there's a lot of these, and some of these things are free actually, at least for the basic license, and I've audited a couple of these groups personally in terms of their compliance. So a lot of good technologies out there, and we're not talking about a bazillion dollars here either. It's not that expensive. And just to be clear, OCR has not reviewed the business associate agreements offered by those listed vendors, and that does not constitute any endorsement, certification, or recommendation of those technology, software applications, or products. There may be certainly other technology vendors that offer HIPAA compliant video communication products that will enter into a business associate agreement. OCR will not impose penalties against covered providers for the lack of a BAA at this time with video communication vendors or other non-compliance with the rules that relates to the good faith provision of telehealth services during this public health emergency. So again, being very careful here in terms of good faith. And this is what I mentioned earlier, some kind of authorization like this, even if you, in this day and time, you can't exactly get a signature, but even if it was some kind of email exchange, at least it gives some sort of implied consent. They understand this. It's not secured, even though, or it's okay that we use it currently, but it's still always, even in normal circumstances, a good idea if patients want to communicate through a non-secured method that they accept the risks, and even in normal circumstances. So you could copy that, or, I mean, there's plenty of templates for confidential communications request form online. So now let's shift gears a minute here and talk about some things we need to be concerned with relating to telemedicine / telecommuting, because a lot of folks being sent home are not used to working from home and don't understand some of the idiosyncrasies of working from home and some of the pretty significant risks that are there from working at home. So HIPAA, even under the circumstances, is one of the most, or probably the most critical aspect to ensure compliance with when we telecommute as a medical practice. Protected health information, PHI or EPHI, you can call it electronic, and other confidential information is every employee's responsibility. And it would be a good idea to have some kind of telework policy drawn up as quick as you can so they understand that. Just because there's some lax provisions currently federally, that does not mean we can be careless, because negligence under the states still applies. So any practice patient-related materials taken to the remote work area needs to be maintained in the person's designated remote work area and will not be made accessible to others, like viewing their computer display. When they're working, doing practice work, whether it's a biller or whoever, that needs to be done in more of a private room. And absolutely certain, if it's a provider doing telemedicine through, say, FaceTime or something like that, video, and kids are walking around behind you and a kid sees these things, and that would not be good faith. I mean, you can't have family members walking around behind a doctor or any kind of provider providing telehealth in these circumstances. So everyone needs to agree that all confidential information, including PHI and EPHI, will only be accessed through and stored within the practice's internal network. Ideally, we don't want to download any protected health information to that local machine. You want to keep it on the practice servers or in the cloud EHR system or whatever you're using, if possible. The number 2 way health records are breached in the United States, or health information, is loss or theft of non-encrypted portable devices. So if encrypted and they were lost, it would not be a breach. So ideally, we do not want to ever put any protected health information on a portable device unless the thing is encrypted. Again, that's the number 2 way health records are breached. And when we talk about compliance with the HIPAA security rule, it's all based upon risk mitigation. The number 1 way health records are breached is hacking, ransomware, that sort of thing, which we'll talk about. Number 2, loss or theft of non-encrypted portable devices with health information on them. So which brings me to encryption, and I don't want to get too much geek speak here, but this is important to understand the concepts here about why we need to do this. For example, wireless. When we work from home, we use wireless networks, many of us. And I don't think this is a big problem anymore, but make sure that the wireless that you're using is encrypted with at least an 8-character complex password. Do not use public Wi-Fi, even though we're not really allowed to go anywhere these days anyway. That would kind of mean, like, don't use Starbucks Wi-Fi or the airport's Wi-Fi to do any kind of telemedicine. And always, if possible, encrypt the portable device, the smartphone, the laptop. That's known as hardware encryption. That protects you from loss or theft. If it's impossible to do hardware encryption, because it is, if it's a Windows home-based operating system, you cannot encrypt a Windows home-based operating system, only the professional level ones. So if you can't do that, and if you do need to download sensitive stuff, put it in one encrypted folder on the desktop, or if it's just one file, encrypt the one file, like an Excel spreadsheet. Any IT guy can show you how to do this. It's not hard. It's very easy. I don't want to get mired down in how you do all of this, but it's not that difficult at all. And again, if a device is stolen and it's encrypted, it's not a reportable breach. We would still do our investigation, and we would conclude that this is not a reportable breach due to the fact it was encrypted to either hardware or file or folder level. the security of the practice-owned property, if they're bringing practice-owned stuff home or they're using their own stuff, that's as important as it would be in the office. That would include personal devices if used to access, transmit, or store protected health information. And whatever your practice policies are on passwords, we need to have that at the remote work area as well. And 8 characters and complex. That's the minimum under HIPAA. 8 characters and complex for a login. Now, an iPhone's different. You use a PIN or biometrics. So if you're not able to access a network drive or electronic health record system, and you do need to save something to that machine, it would be a good idea to notify the practice's HIPAA security official or the IT person. Ideally, that would be channeled through the HIPAA security official, who typically is the practice manager at a small practice. All patient information and network connections must be secured. Now, again, I don't want to get too technical here, but what you do not ever want to do is access a remote desktop connection, like through Microsoft. It's called RDP, remote desktop, to a public IP address. And a novice IT person could do what's known as a network address translation, where they put your public IP address, which anyone can see, and make that accessible to that certain port 3389, to get in for remote access. It's very simple. It's really easy to do, and you can get in easily. The problem is, any 13-year-old kid in Indonesia running a port scan could hack that thing. And that would not be, quote, good faith. That is not reasonable and appropriate when there are many other secured ways to get into your systems remotely, like go to my PC, log me in rescue. There's a bunch of technologies that are super cheap that provide encrypted access, or maybe a VPN you can have, if depending on the type of firewall you have. So a good telecommunicating program includes also, if possible, working in a paperless environment. Unless there's a reason to be printing out patient information, you should not be doing that. Ideally, you want to keep it electronic. You want to keep it ideally in the electronic health record system. And in a perfect world, your computer that you're working from at home is nothing more than a conduit to access that cloud system. Sort of like your bank. You know, you go into your bank, that's through an encrypted portal. That's how a lot of these cloud EHRs work. But even if it's not cloud, you need to go into your practice through some kind of encrypted means and then access it that way, but your machine is only a conduit. That's really how we want it. Let's talk about youngins, always stirring up trouble. Certainly you do not want kids playing World of Warcraft or whatever games they play these days on the computer that is used to access, transmit, or store protected health information. So, and this is a bit of a struggle for a lot of folks, considering kids can't go to school now based upon the law. So telecommuting, in theory, does not replace the need for child or dependent care. Staff members should be expected to make arrangements for children or dependents that require care to ensure that they do not interfere with your performance expectations, and certainly not privy to any confidential patient interactions. Acceptable arrangements could be off-site daycare or another primary caregiver. Now, this is a little bit of a gray area because of the current situation. But the bottom line is no one other than the employee should be allowed to use that practice-owned computer or even personally owned if you're using that thing to access, transmit, or store protected health information. So, unfortunately, with what all's going on, these hackers have really upped their game and into even more insidious tricks. And by the way, hacking is by far the #1 way health records are breached in the country. This is a billion-dollar business with a B, billion. The risk for these guys is very low. The reward is very high. Almost all of them are overseas, so it's very difficult to catch them. So let's talk about some things that could open us up while we're doing this telecommuting. First off, all the technology in the world, the greatest firewalls, antivirus, all this stuff, will not fix human stupidity. We are the weak link. There's no firewall, there's no antivirus, there's no update, and there's no patch for human stupidity. So we can't really be HIPAA compliant without also educating all staff members, and I mean from the board of directors down to the part-time scheduler, on common sense cybersecurity threats like email spoofing. So you can receive an email, and these hackers are clever. They could look at your website and figure, oh, Dr. Joe Blow, he's the doctor, so I imagine he's probably the boss there. I'm going to spoof his email, and I'm going to email Tommy Smith. Tommy Smith may be a biller, I don't know. I'm going to spoof the doctor's email and email Tommy Smith. Hey, Tommy, I'm locked out of the cloud-based next-gen system or whatever EHR you're using. I'm locked out of the system. Can you provide me your username and password so I can log in? I don't want to bother IT right now, and I'm really busy. Well, that's from his boss. If Tommy replied with his access controls, you're doomed. It's all over. Now the hacker somewhere in Russia logs right in, and in a few minutes you're going to receive these emails demanding you pay them a bunch of Bitcoin, which is a cryptocurrency, or they're going to go public with this, all because of just an error in judgment. And that's not a virus either. They're not going to catch this. This is a spoof. It's not a virus. It's just a trick to get those access controls. So again, I think most folks understand this, but never, ever transmit your access controls to anybody, ever, unless it was through some kind of encrypted channel and you pick the phone up to confirm that they're asking for them. So now let's talk about ransomware. This stuff is very dangerous. Ransomware is a type of virus, a type of malware that comes through email. It comes through email. It's very clever. It attacks your folders on your desktop and it encrypts them. It attacks your files on your desktop and it encrypts them. It attacks file shares that you're connected to within a network, like on a server. It also attacks databases, attacks them and encrypts them. It encrypts them, and now you can't get your stuff back until you pay some creep X amount, again, of Bitcoin for them to give you the decrypt key. So it's a very nasty virus. It comes through those phishing emails, phishing spelled with a PH. Now, the problem is the federal government made this official last year. A ransomware attack that attaches to non-encrypted folders, file shares, or databases that have health information in them, that's a reportable breach. We can argue all day long and say, well, wait a minute, they didn't log into the application to see anybody's health information, so how's that a breach? The government doesn't care because it took possession or control, even if it's in your server environment, even if it's on your laptop. They took control, that's a breach. And that's a nightmare. Now, the one saving grace here is if they're already encrypted, if your database that hosts your EHR is already encrypted, which that's not something most folks have control over, that's more of the vendor. File shares and folders, though, you do have more control. So never put anything on a folder on a desktop that's highly sensitive unless you encrypt the folder. I wouldn't even do that on a personal level. So again, good technology, education, and making sure we encrypt data. Encryption isn't required under HIPAA because sometimes it's just not possible, but if possible, we do want to do that to protect ourselves from these types of viruses. Now, these are called social engineering. They try to trick humans. It's a lot easier to trick a human than it is to bust through sophisticated firewalls. So phishing, again, with a PH, and you know, when all of this mess is over with COVID-19, you might consider there are groups you can hire that actually will spam your organization intentionally. It's called a phishing campaign, sending all these fake emails, and whoever falls for the trick gets redirected and retrained, you know, that type of thing, just for a learning tool. But typically they will use some kind of threat or fear or perhaps enticement to get you to click on a link. Like this one from Facebook. Says that you have some kind of, and I'm not picking on Facebook, that's just a very popular company. They'll even use their logo. And you have some kind of copyright problem. And if you do not click on this link, you will be permanently blocked. That's your threat to get you to act. Now, this one did have a spelling error, but many of them don't. They're getting very, very tricky. So just keep an eye out on that. And I know you've all seen these things, but just be careful. It's unfortunate, but that's just how things are. And it's much worse these days with all this going on. Now, real quick about emailing and texting. So encryption when possible. Now, this is new under HIPAA. Email encryption isn't required, but protected health information isn't created equally. So if one doctor is emailing to another doctor an x-ray of a bicuspid tooth with a name on it, that's PHI. It's generally acceptable to email very nominal information like that without encryption. However, it would never be acceptable to email, say, an HIV record or a substance abuse record or a mental health record. Those are entirely different animals. Now, with texting, we are not supposed to text at all anymore without encryption. Now, you can text with a patient with consent. If they opt into it, you can communicate with a patient through non-secured means if they consent, even in normal times. If you want to text amongst each other, then you will need to download some type of third-party text encryption app, and there's a ton of them out there. They're very cheap. They're made specifically for healthcare, and the reason the government's so negative on texting is because the protocols used to transmit a non-encrypted email versus a non-encrypted text, the text is about 20 times more likely to be intercepted. It's almost creepy. Someone could be sitting in your parking lot with a tablet or a laptop or a smartphone with what's known as a packet sniffer and intercept text all around. So that's the main reason that's no longer accepted. Now, under these circumstances, and even in normal circumstances, a patient has a civil right of access to their health information. If I say, I've moved to San Francisco, I want you to email me all my health records, and you say, no, we're not doing it because we can't encrypt it. And I say, I don't care, I want you to send it. I don't care if it's not encrypted, it doesn't matter to me. You have to send it, even if you can't encrypt it, even if it's highly sensitive if that patient demands it. Now, if we do that and it's intercepted, are we responsible? No. While we are responsible for adopting, quote, reasonable safeguards, like making sure you enter the email address incorrectly, we're not responsible for disclosure of PHI while in transmission based upon that individual's access request to receive the information in an unsecured manner, assuming they were warned of and accepted the risks associated with that unsecured transmission. That means we don't have to go through breach notification. We're not responsible for safeguarding information also once it's delivered to them. I think that's understood. Now, we are responsible for breach notification for unsecured transmissions, and we may be liable for impermissible disclosures that occur in all contexts except when fulfilling an individual's civil right of access to receive his or her PHI or to direct it to a third party in an unsecured manner. It's their stuff. If they want it that way, we can't withhold it from them on the basis that we're unable to encrypt it. A lot of folks aren't aware of that. A couple other things in working from home: no speakerphones. Do not use speakerphones when speaking with patients. We shouldn't be doing that, period, at the office as well. Same concepts. And keeping voices low when, especially telemedicine, working with the patient, it would be a good idea to have a headset on where it's a little more clear and you're not yelling into a kind of an old school microphone, which I don't think people do anymore, but just always low, as quiet as reasonably possible. Oops, I think that's a duplicate slide. But yes, we are all responsible under this law. It is a personal responsibility law for sure. Trial attorneys. So one little subtle change that happened back in 2013, late 2013, federal government told all 50 states attorneys general to implement law of remedy. And I will let Lee speak to this here, and if you want to take it from here about this whole right of remedy and how that sort of plays out.
Sure, happy to do that. So there's no private cause of action allowed where an individual can file suit under HIPAA. Certainly, an individual would be encouraged to report to OCR a violation of HIPAA, and they should do that within 180 days of the violation. But what this means, this paragraph, this section, is that you don't have a right to sue based on a violation of HIPAA alone. And so trial attorneys have pursued state rights of action to claims that where damages were caused by HIPAA violations. And so many states have looked at whether a violation of HIPAA could be the basis for other state claims. And many states have looked at it. Arizona has held that a negligence claim could be brought for a HIPAA violation. Connecticut, Ohio has looked at it. Georgia has as well. There was a cyber attack on an Athens clinic, so that some patient information was disclosed by individuals who hacked into the system at the clinic, and actually the clinic was sued based on several theories under Georgia law: negligence, unjust enrichment, and breach of implied contract. So although there's not a private cause of action where an individual could sue directly under HIPAA, you certainly could potentially sue for other causes of action. And so the next slide, negligence is a reminder that we do have some lessening of certain regulations and requirements and potential penalties under HIPAA during this time, but we need to make sure that we apply the standards to keep things as tight as possible, like disclosing the minimum information, keeping the information as private as possible, only using the information in good faith and as necessary for the healthcare, and only disclosing information to individuals who are authorized to see it under HIPAA. The omnibus rule of HIPAA did not impact an individual's right of action. There was not a new cause of action created. It was an opening to state's attorney general to be able to bring causes of action under HIPAA on behalf of residents. And so someone who had a claim would want to disclose it to OCR and then determine whether you have a right of action under the state. So there's the slide, states are falling like dominoes, meaning that there are private causes of action in a civil context based on HIPAA violations. And so we see individual court cases across the nation where HIPAA violations have occurred. There was a New York clinic where the clinic was sued for a violation by a nurse who disclosed the sexually transmitted disease status of a patient who was the boyfriend of the nurse's sister. That nurse texted her sister and warned her about this boyfriend's medical condition. When the clinic determined that, they let her go. They fired the nurse, but it was the clinic that ended up being sued by the patient for the violation. And ultimately, the clinic prevailed and they were not held liable for that breach by a provider. But that shows you an area of exposure, certainly, to a practice for the conduct of a member of their staff. So we do need to be very careful and as protective as possible around HIPAA and follow the guidance, and certainly also in practices hold practitioners responsible for their own breaches. And so then the next slide, private legal remedies. If the violation does result in damages, which is that the individual patient who had their PHI disclosed, they may have a civil claim. And some other examples of private causes of action would be financial loss, slander, or defamation. If things like that occurred as a result of a violation of HIPAA, then under your own state law, it might be possible to bring a claim like that.
Yes. Also, the federal government has talked for years about doing a profit sharing type of thing for these gigantic fines that they're doling out. The patients don't get anything. And the ones that are, it's kind of funny, Uncle Sam gets everything. The patients don't really get anything, but that's still not there. It's just, they talk about it, but nothing ever happens. So this is sort of where we stand these days with individual liability. And it seems to me if it's a great big fine under HIPAA, groups don't really have a strong leg to stand on legally, because many of the same, I've worked in a lot of, as an expert witness in a lot of these things, a lot of the same things are asked for in a litigated case as would have been asked for by the federal government in an audit. So very important to be proactive just in general with all of this stuff. It is what it is, unfortunately. So just and again, I didn't want this to be fear-mongering, because in the end, this is a lot of common sense, best practices. It really is. It's just important to be proactive. A couple tools out there for you guys. Healthit.gov is a fantastic resource. It's one of the best federal websites, I think. A lot of good information. You can join their newsletter. They're sending a lot of stuff out these days. You find a lot of new things going on with HIPAA as well here. They do have a security risk assessment tool version 3.0. I have not used it. I used the old tool they had. I did not like it. It was too porky, but maybe 3.0 is better. I don't know. There's many ways to get these things done as long as they're done and you stay on top of that. Very important. If you want a truncated list of all of the standards and implementation specifications of the privacy, security, and breach notification rule, here is a little link to that. Not the most exciting read, but it is right there straight from the government. Don't fall for snake oil. There's a lot of misinformation, and I mean a lot of it, about this law. And in part, I blame the federal government because they don't explain it very well. It's almost like an enigma. You have to, I've been doing this for years, and still you have to dig through and find what's new. But just fact check with HHS. They have a really good frequently asked questions. And don't forget about your state laws. Usually the federal is pretty consistent, especially with the security rule, but you do get into some weird state laws about how long do you need to keep medical records. Is a 13-year-old pregnant girl who's still on her dad's insurance, is she now an emancipated minor? Things like that. And the snake oil part are a lot of groups trying to sell you something many times you may not even need, claiming HIPAA. So just always fact check with this stuff as well. If you are ever audited by the federal government for HIPAA, this is the protocol that they go by at this link. This is a really, really long web page. I wish they put it in a handy tool, but they don't. And this goes to the privacy, security, and breach notification rule. It's more like a checklist of, do you have this? Do you have that? So there's that. And the bottom line, and this is a quote from HHS, and it's all about reasonable and appropriate. Covered entities and business associates are expected to follow these standards, implement the proper policies, procedures, and technologies to reasonably show the organization is making an effort to protect against common threats and vulnerabilities. I apologize for my cuckoo clock in the background, but forgot to turn it off. So be proactive, take action. You don't want to be in a reactive state if something bad occurs. Even with things lifted, we still have to be diligent here. So with that, I think that is the last slide. Oh, here's some resources here. There.
Okay, thank you, Brian and Lee. Great information. So the link that's currently on your screen is for our osteopathic.org/COVID-19 page that is updated regularly with different presentations that come up. And then the AOA online learning link, that is for the upcoming webinars. We actually have a webinar tomorrow on getting paid for telehealth, the new rules for documentation and technology. And then on the 9th, on Thursday, we have billing and coding under new telehealth rules, all related to the COVID-19. So please make sure you register for those. And these are some telemedicine platforms. Our member value team has worked with Cirrus Health and then with Bluestream Health, who have platforms that are available, and they are willing to work with the AOA members on it. So you actually, those are ones that we vetted and we looked at. Those are ones you should look into if you're looking to get into a platform to continue